In recent years, the illegal use of prescription drugs has become an increasing problem. Pain relievers used recreationally are the second most commonly used illegal drug in America. Young people are especially at risk for prescription drug abuse. Statistics show that they are now more likely to experiment with pain relievers than marijuana. 1/3 of all new abusers of prescription drugs in 2005 were 12 to 17-year-olds. Every day, 2,500 youth aged 12 to 17 abuse a pain reliever for the very first time. The Rice County area is experiencing its own problems with prescription drug abuse. According to the 2009 Northfield Student Survey, 5.4% of middle and high school students had used prescription drugs that were not prescribed to them in the past 30 days. The recent increase in prescription drug abuse could be partly due to the fact that prescription drugs are often easy to obtain from family and friends. Only 12% of Faribault and 5% of Northfield students find it hard to obtain drugs that were not prescribed to them. 38% of Faribault and 47% of Northfield students believe it is easy to obtain prescription drugs not prescribed to them. This figure is up significantly from the same studies the previous year. 3 categories of prescription drugs are commonly abused: opioids or painkillers such as OxyContin, Vicodin, and Demerol, central nervous system sedatives such as Nembutal, Valium, and Xanax, and stimulants such as Adderall and Ritalin. The health risks associated with prescription drug abuse vary depending on the drug. For example, abuse of opioids and pain relievers can slow or stop breathing. The abuse of sedatives can result in seizure, respiratory depression, and decreased heart rate. Stimulant abuse can lead to high body temperature, irregular heart rate, cardiovascular system failure, and seizure. These are only a few of the health risks and side effects associated with prescription drug abuse. Inappropriate use of prescription drugs, including use without a prescription or medical supervision, or using in a manner other than exactly as prescribed, can lead to addiction in some cases. Prescription drug abuse can also lead to the use of other illegal drugs, such as heroin. Dr. Resnikoff, addiction specialist at Northfield Hospital, explains the link.
Once a pain pill habit is established, the user will have to use every day, or they'll go into withdrawal. And once someone has an established pain pill habit and they're facing withdrawal, sometimes what happens is they run out of pain pills. They have no supply of more pain medications, and then they're forced to look for alternatives. And at that point, they will often get introduced to heroin or the heroin culture.
There are several ways to limit the access to prescription drugs. Safe use, safe storage, and safe disposal of prescription medications are all critical pieces of preventing opportunities for prescription drug abuse. When using prescribed medicines, read and follow all directions. Take the recommended dose, not more or less. Take the medicine the number of times and with the frequency recommended. Do not share prescription medicines with another person, and do not take someone else's prescription medicine. Store medications in a place away from children, teens, and guests. Lock them up if necessary, especially narcotics or mood-altering medicines. Make sure to keep medications in their original bottle or package, and follow storage directions on the medicine container. Disposing of unneeded medications is a key step in preventing prescription drug abuse. Local healthcare providers, law enforcement, and community groups introduced Take It to the Box beginning September of 2009. Residents can now take old or unneeded medicines to the medication disposal boxes. These are located at Northfield and Faribault Police Departments. The disposal boxes are available 24 hours a day, and there is no cost to drop off medicines. Drugs dropped off at these locations will be taken away for safe and environmentally responsible disposal. When dropping off medications, leave the medicine in the original package or bottle. Cross off your name and other personal information. Do not cross off the name of the medicine. For more information about the Take It to the Box program, please call the Healthy Community Initiative at 507-664-3524 or visit ricecountychc.com. Despite the best efforts to prevent the abuse of prescription drugs, some individuals may become addicted. Fortunately, there is help for those who are addicted to these medicines and other drugs in our community. To learn more about local treatment options and resources, visit the Rice County Chemical Health Resource Directory at ricecountychc.com. Click on Resources. One new community resource is the Opiate Agonist Therapy Clinic at the Northfield Hospital. The clinic offers services for those addicted to heroin and other opiate drugs.
The treatment of choice for an established heroin user is a combination of therapy, talk therapy, counseling, and opiate agonist therapy. And opiate agonist therapy is replacing the dangerous, short-acting, intoxicating heroin with a longer-acting, slow-release, non-intoxicating substitute. And this substitute keeps them out of withdrawal, reduces their cravings, and has some mild pain-relieving effects as well. So it also, what happens is there's a shift, ideally, there's a shift from interacting with drug dealers to interacting with counselors, physicians, nurses, and the hospital. So what we do in the clinic is we have people come in once a month, more frequently if necessary, and see how they're doing. Talk to them about their lives, talk to them about their legal issues, and talk to them about their drug use. And we will check urine drug screens, and then in addition to all of that, we'll give them this opiate replacement, which is called, the trade name is Suboxone, and the drug name is buprenorphine. And it's a very safe, long-acting, non-intoxicating replacement for heroin. And as long as they're coming in and doing well, we can give them this medication, and we seem to have a pretty good success at keeping people comfortable, getting them back to work, and managing their addiction.
If you or someone you know is experiencing problems with addiction to heroin or other opiate drugs, please call Dr. Resnikoff at 612-873-9780. You will reach his voicemail, where you can leave a message with your name and phone number. Dr. Resnikoff will personally return your call. Please do your part to reduce access to prescription drugs in the Rice County area. Use prescription drugs safely by following the instructions of your doctor and the information on the label. Store drugs safely, keeping them away from others and in their original package. Safely dispose of old or unneeded medications by taking them to the disposal boxes located at Northfield and Faribault Police Departments. Working together, we can make our community a safer place for everyone.